Good afternoon, I'm Karen Holmes Ward. Welcome to City Line. May is Mental Health Awareness Month. Today we are focusing on the struggles that more children are facing, especially in communities of color. New studies suggest the pandemic is accelerating a growing trend. According to the National Institute of Mental Health, of the 3 million American adolescents who experienced major depression in 2020, almost 2/3 received no treatment. 50% of all lifetime mental illness begins by age 14 and 75% by age 24. According to the Surgeon General, emergency department visits for suicide attempts were 51% higher for adolescent girls in early 2021 as compared to early 2019. Joining us now is Dr. Andrea Spencer. She's the Director of Pediatric Integrated Behavioral Health and a child psychiatrist at Boston Medical Center, and Toy Burton, Executive Director and founder of Dee Dee's Cry, an organization dedicated to mental health and suicide prevention in communities of color. Thanks to you both for joining us. Dr. Spencer, I'm going to start with you. Very stunning statistics. Your recent study on mental health and children also just very informative. What else did you find?
Yeah, so specifically we found right here in Boston, at Boston Medical Center, we found really high rates of anxiety and depression symptoms during the pandemic. We found that those rates among young kids, ages 5 to 11, more than tripled during the pandemic compared to before the pandemic. And that's really striking. You know, when we did our study, most of the research on pandemic mental health effects were in adolescents and adults. And to find such high rates of depression and anxiety in such young children is really alarming, especially because of, as you just said, that most mental illness begins with children, and this leads us to worry about, you know, what's going to follow from this, and how are we going to manage it?
It may seem obvious, Dr. Spencer, but if you could just talk about how the pandemic has created a mental health crisis in communities of color and among kids.
Yeah. So in our research, we found some really important relationships with certain stressors during the pandemic. One was with parent mental health, that parent mental health was related to these high rates of anxiety and depression in kids. Another thing we found is that increased screen time, which honestly was the case for many of the children that we studied. High rates of screen time was related also to increased anxiety and depression symptoms. And then school engagement was a really important protective factor. So more school engagement meant lower rates of depression and anxiety. So these are some of the things that we have been thinking about as stressors during the pandemic. And then I want to add that we also have a workforce shortage, a really important workforce shortage for mental health professionals, which is certainly contributing to our response to this.
Toy, Dee Dee's Cry aims to create a space for conversation and lift the stigma on mental health. Are you seeing what Dr. Spencer's study has found in the communities that you're working in?
Yes, definitely. So during the height of the pandemic and during lockdown, a lot of people reached out to Dee Dee's Cry about, you know, like home insecurities and food insecurities. And of course, if the parent is feeling stress or having anxiety, it does rub off on the children. And at that time, being a preschool teacher and having small ones in my classroom, I saw it firsthand.
What kinds of things are the parents telling you when you speak with them?
So at that time, many people were losing their jobs due to the lockdown. Many parents were not sure if they was going to have a roof over their heads. So it caused anxiety, it caused depression, and their children not being able to go to school. So even where I worked, we had a hybrid model where some kids came in and some were on screen. the kids just miss their teacher, me, and they also just miss playing with their friends. So, of course, that caused anxiety on them because they were wondering when are they going to go back to school.
Sure. And under any circumstances, children, absorb what's going on in the home. They absorb their parents' behavior. If they see their parents going through stress, that stress comes back on them.
Exactly, yes.
So, Dr. Spencer, would you talk a little bit about the role that social media plays for kids and mental health?
Yeah, I think one thing that's important to know is that our research didn't separate social media versus other media, but we know that, the influence of social media is huge. Now, I don't want to kind of downplay some of the positive effects of being connected over devices because, many of our kids, especially during the height of the pandemic, weren't having any in-person contact. And so it was important to be able to stay connected. But the other thing that I saw clinically with my patients is an increase in use of social media for really young kids in particular. And when you think about all of the things that you can see over social media and how it's harder for the younger kids in particular to understand what's real and what's not real and what they should look at and what they shouldn't look at, it's even hard for adults to do that. But when you think about how a younger kid would do face with that, that can be really important to understand that we've exposed really young kids to that.
I know I found it difficult just to deal with the Zoom over a period of 2 years. Being on Zoom all the time just, is aggravating.
Yeah, yeah. It's not the same.
No,
it's not a replacement.
It's tougher for kids. Toy, you were saying yes?
Yes, definitely. So in our classroom, we had certain time period for a child to sit there and engage with the teacher and the other kids in the class. And at that time, what if the child doesn't want to be sitting at the table or being on the laptop? So it was definitely difficult. So like I said, how we were having Zoom anxieties, children was going through it too.
Sure,
Yes.
sure. Toy, how are you trying to break the stigma of mental health in the Black community?
So at Dee Dee's Cry, we feel like it's important to talk about it, just to let people know that they're not alone. I am a suicide attempt survivor, so I definitely talk about that. And when people hear me talk about that, it gives them permission to share what they're going through too.
Is that why you started Dee Dee's Cry?
So I started Dee Dee's Cry is because I was actually online looking for resources, and being on these websites of organizations that focus on suicide prevention, I didn't see anyone who looked like me. And where their events were happening, I was like, this isn't for somebody who lives in Roxbury, Dorchester, or Mattapan. So I decided to create something that would connect the community to the resources.
Dr. Spencer, please talk to us about what parents should look for if they think their young person is experiencing difficulty.
Yeah. Well, for increases in depression and anxiety, what you want to look for is social withdrawal, which means not interested in socializing as much with other kids, wanting to stay at home or in their room more, worrying or being preoccupied about things that little kids shouldn't worry about, and also sometimes tantrums or increased oppositional behavior. While, often people kind of think of that as, sort of quote unquote, just a behavioral thing. Sometimes that's a really important manifestation of a mental health concern, especially if it, is rising to new levels.
All right, Dr. Spencer and Toy from Dee Dee's Cry, thank you both for joining us today. Now, if you or a young person, needs help, please call the National Suicide Prevention Lifeline. That number is 800-273-TALK. That's 800-273-TALK, or if I could talk, you can also call 911 and text 741-741 to be connected to a free trained crisis counselor on the crisis text line. Young activists speaking out and taking action. Up next, advocating for change, how dancing videos turned into a movement. That's next on Cityline.